Seniors at pharmacies, Capitol Building, pill bottles labeled $550 per month, headline flashing, drug prices shelved, new Medicare rules take effect. It's official. The biggest prescription drug overhaul in Medicare's history is now in motion. Starting this week, the Biden administration has implemented the first wave of drug prices caps under the Inflation Reduction Act, a long-promised policy now becoming reality for millions of Americans. President Biden seeing legislation visuals of HSS logo Medicare.government homepage. The law passed in 2022 gives Medicare the power to negotiate prices directly with the pharmaceutical companies for the first time ever. And the aftermath of behind-the-scenes negotiation, the new prices for 10 high-cost drugs are now locked in and active, with more cuts coming in 2026 and beyond. These drugs include major treatments for diabetes, cancer, blood clots, and heart disease, all commonly used by seniors. Shows drugs like Eliquis, Jardiance, and Inveral, with old and new prices. Take Eliquis, for example, used to prevent strokes and blood clots. Before this law, some patients paid over $6,000 a year out of pocket. Now, that's being kept at just a fraction of the cost for Medicare enrollees. And thanks to new annual limits, no senior on Medicare will pay more than $2,000 per year for prescriptions by 2026. Seniors being interviewed, this is a lifesaver. I don't have to choose between meds and groceries. For many seniors, the change is already making a difference. One Florida retired told reporters, I used to sleep to my pills in half of the make them last. Now I can afford the full dose without worry. Pharmaceutical company HQ protest sign statements from drug manufacturers. But not everyone is celebrating. Drug makers like Merck and Johnson Johnson have pushed back hard, calling the policy unconstitutional and warning it could hurt innovation. Multiple lawsuits are now working their way through federal courts, and big pharma arguing that price negotiations amount to government price controls. The legal fight could take years and may even end up at the Supreme Court. Lawmakers debating in Congress slipped screen of Democrats and Republicans. Politically, this is a major win for the Biden administration, but also a flashpoint in the healthcare debate. Democrats argue this is a proof that government action can lower costs and help working families. Republicans warn it may limit access to new drugs and create long-term economic consequences. And with the 2026 midterms fast approaching, both sides are using this as a rallying cry. Seniors filling prescriptions, graphs showing price trends, scrolling headlines, next drugs announced in 2026. So, what's next? By the end of 2025, the administration will announce the next round of drugs up for negotiation, expanding the program even further in 2026, 2027, and beyond. And with millions of Americans impacted, the success or failure of this program may be one of the defining healthcare issues of the decade. Tell us in the comments, has this policy helped you or your family? Subscribe for more updates on healthcare policy and the 2026 election.